So yesterday we talked about different type of modalities in GIT, gastrointestinal tract. Okay, like X-ray, we have barium swallowing, barium meal, barium follow through, barium enema. Okay, CT abdomen. In CT abdomen we have plain CT without contrast, NCCT with contrast, CECT with specialized technique, that is CT enterography, and we have MRI. MRI we have plain MRI and MRI enterography again, and you have ultrasonography, endoscopy, and we have virtual and colonoscope. Okay, so these are the imaging modalities we discussed yesterday. So let's talk about the different those modalities anatomy, how the normal anatomy normal anatomy will looks like in the X-ray. So I have the images here, different images. You can see that X-ray, two types of X-ray is there. This is CT scan, this is MRI, and this is again CT scan. So we will discuss all those in today's class. Let's start. So basically, if it is the abdominal X-ray, so whenever you will get the film, so start with right side. Start with right side. So right side is liver. You have this. This is the diaphragm. Okay. Below the diaphragm, we have liver. Okay. So this is the liver. Below the liver, you will able to see the right side of kidney. Okay. And liver opposite side, you have spleen. Okay. Opposite side. Below spleen, you will get stomach. Here, this is the blackish part because it have gases. Okay, liquid type, so that's the reason you will get to see in black color. I already discussed, and it is a left kidney. Okay, and likewise you have to come right side, you will get the ascending colon. This is the ascending colon. Okay, and you will get in the middle, you will get small intestine. Already yesterday I also had to told jejunum, ileum. Okay, will get in small intestine. Duodenum is attached to the stomach itself, and you will get descending colon, large intestine. Ascending, here you have the transfer colon, here you have descending colon. This is how the simple X-ray looks like. But nowadays it is easy because we have radiologist. He will give the impression. Okay, but as a doctor, we have to know this anatomy. Next come detail X-ray. Here you have the everything. Here is the 11th rib. This is the 11th rib. 12th rib, other are floating ribs we will call here. You have the spleen at the level of 11th rib. Here you have the, sorry, liver, opposite liver you have spleen. Here you have the right kidney, left kidney. You have to see all this. Ascending colon, descending colon. Okay. Yeah, I missed here. You will get rectum here. You will get rectum here. Here you will get the rectum. Rectum. This is the rectum. As already you studied that in X-ray, gases are in black color, bones are in white color, bright color. So all this you have to match here. Okay, those are the basics. No? So again, you have here you have the pelvic region, rectum, small intestine, ascending colon, descending colon, iliac. This is the vertebrae column, fifth vertebrae, fourth vertebrae, third vertebrae, second lumbar, first lumbar. So lumbar region, this is the sacral bone, tailbone, femur bone. So everything you will able to see in this X-ray in detail. Okay, so whenever you will get the X-ray, first you have to note down the symptoms. Okay, and you have to match that X-ray with that symptoms. If a patient have left side pain, so you have to most focused on left side. Okay, what is the pathological findings? Any obstructions, anything that may be giving trouble to the patient. Okay, you have to significantly notice that. You have to notice that. Okay, so this is the basic simple X-ray abdomen. You will get all the details, basic details, not in-depth details. You will get basic details. How this is how you will look like the liver. Is it anything, any stone in gallbladder, any stone in right kidney? Okay, you will able to see the stones in the X-ray because it is a hard substance. You will get to tiny stones. We will study, okay, pathological findings in important pathological findings in X-ray, CT, abdomen, etc., etc. How it will looks like. This is the normal X-ray, not abnormal. Abnormal X-ray. Okay. Next we have CT abdomen. This is CT abdomen. Cross section, slice from upper portion from the thoracic below the thorax region. You are getting the slices of each and every part of the abdomen. Okay. So again, you have to start with the right side only. Can anyone tell that how to identify whether it is X-ray? Sorry, whether it is CT scan or MRI? Can anyone? How to identify it? A
It
patient,
can. It can, sir.
how are getting that there is a CT scan? How do you know?
The overall outside is black, sir. Black.
Hmm. The thumb rule to identify whether it is CT scan or MRI. I already told you that to see the bone, to see the bone. In the CT scan, the bone will appear brighter color. In the MRI, it will appear in dark color, gray color. Okay. So you can see this is the bone. This is the bones. All this appears in bright color. So this is CT scan. This is the bone. Which bone? Can anyone tell? This is a vertebral column, backside, because it is doing the cross section cuttings like potato. Right? While our ladies will cut the potatoes in this manner, slices. Okay, so this is the vertebral column. These are the ribs. Ribs also bone. Vertebral column is also a bone. So this is the vertebral column, and we have this spinal cord. So again, we have to start with the right side. This is the right side. Our opposite side is right side. Scanning. Okay. In the scan also, you will write here right R, here right left. Okay. So it doesn't have any problem regarding that. You have to see that. So this is the starting with liver. Again, see there's a liver. This is the left lobe or liver, the ligament of liver. Okay, this is quadrate lobe. This is the artery, gastrointestinal artery. This is the bile duct. You have to see that. Okay, right lobe of liver here. This is the right branch. Okay, artery. Vena cava. This is the vena cava. Renal artery. You have renal artery here. This is the kidney. You can see this is the kidney. So this is the liver associated arteries and veins. This is the kidney, right side kidney. And you have this is the renal cortex. Above you have renal cortex. And you have vertebral column. I already told you that the left side. Now important. Left side. This is the pancreas. This is the pancreas. Body of pancreas. Okay. And this is the spleen. Here you have the spleen. And again, it is the left kidney. Okay. Helium kidney. This is the kidney. And helium. All these things are available. Abdominal aorta. You can see abdomen here. Most abdomen here. Sorry. Okay. So this is the muscle. These are the muscles. Here backside muscle. This is the abdomen. Here we have the abdomen. Splenic arteries, spleen, everything are there. So here we have the upper cross section. Below you will get the large intestine, small intestine. Like this is the shape of the body. These are the abdominal parts. Okay. While cutting from the upper cross section, you will get first liver. Liver have here you have the stomach, spleen, pancreas. You will get that image. After that, half the part of the liver, half the part of the pancreas, half the part of stomach. Then you will get small intestine, large intestine, upper part. Then you have to lower part, pelvic part, like cutting sections. Okay. So these are the important organs which can seen in the CT scan. Next you have the this is the MRI. Okay. This is the MRI. MRI will get in detail. Mostly simple tissues also you can see in fat tissues also. This is the cross section. Okay. You can start with again right. You will start with rectus abdominis muscle. This is linea alba. All these are anatomy. Don't worry about that. You will get the gallbladder here. Okay. Everything you will get. So all these are written here. But you will come to this part. This is very important. So this is the liver. You will get liver, kidneys are here. And you can see that. This is MRI. So there's the reason. Here it is in dark color, gray color. The bone is in gray color. So again, ribs are also in gray color. Here you have the this is the spleen, this is kidney, both are kidney. This is the pancreatic neck. Okay, arteries, veins, everything you can see in this. Important organs are liver, spleen, kidney are important organs. Other are important but not relevant to us. Okay, we are not the radiologists to see everything in detail. You have to idea about those organs are present in the MRI. Okay, so this is the MRI. Is again, this is the that is the coronal section. This is the lateral section. Likewise, you will get the front view. From the front part, we are crossing like this, cutting like this, cutting middle part and anterior part, middle part and posterior part. These are the lungs, diaphragm. This is the liver. You can see that ascending colon again, right kidney here, and this is the stomach. Here we have spleen, pancreas are available here. This is again kidney. Okay, these are the muscle mass, ilium. These are the lumbar region, sacrum region. Everything is there. Okay, so this is about MR. Sorry, CT scan. This is a CT scan, not MRI. Okay, so we have two things related. That is, one is anatomy of USG and anatomy in endoscopy and anatomy in colonoscopy. So let's see that also. So USG will discuss tomorrow. Okay, here we have the endoscopy. In endoscopy, mostly esophagus, stomach, and duodenum part can be seen in the picture camera. So in there we have the this is the anatomical structure we have because it will give in colorful pictures only. Endoscopy will come in colorful manner only. So it is not difficulty to study. So we have esophagus. This is called esophageal sphincter. This is called fundus, body area. This is greater curvature. This is lesser curvature, cardia. Okay, these are the angles, antrum, pyloric sphincter, duodenal bulb, and duodenum. So these are the anatomical parts of stomach, esophagus, and duodenum. So you can see that this is the endoscopy. First, it reaches to the esophagus. Okay, then it will reach to the uh, upper part of abdomen, that is nothing fundus area, body area, and it is reached into the small intestine, duodenum. Okay, you will get the, this is the epithelial tissue damage. You can able to see this is the damage of epithelial tissues in the mucosal lining is damaging. So we will get a burning sensation while eating spicy food and acidic, okay, acidic environment you can say. So you have mucosal lining damage. Okay. Next we have this image. You can see that this is the esophagus. Number one, pharynx. So start with pharynx. The doctor will see the image of pharynx, esophagus. Third number, junction of all this esophagus. Fourth number, fundus can be seen here. Fifth number, middle upper body width, okay, of the abdomen. Fifth, sixth one you can see middle upper body with retroflex view. Okay. Seventh, angulus disease area. Eighth one, lower body. Ninth one, antrum. Tenth one, duodenal bulb. 11th one, duodenal or duodenum. Ascending, descending duodenum. Okay. So these are the areas where uh, endoscopy to be done to see the internal structures of the upper GI, mostly esophagus, abdomen, and duodenum. Next, we have this is called colonoscopy. This is the colonoscopy. So, mostly any polyps, any uh, construction, or any uh, deformities to be seen, mucosal deformities of large intestine can be seen with the help of colonoscopy. So, this is enter to the rectum and it travel large intestine, the descending colon, transfer colon, ascending colon, till that ascending colon, you can see the images. Okay. So these are the images of, this is the image of colonoscopy. So we'll get the image mostly colorful only. So we have ultrasound that is left. So we'll discuss tomorrow anatomy of abdomen in ultrasonography. Okay, any doubts regarding that you can ask.